Welcome to Bear in Mind, the Brown Psychiatry podcast, clear, current content about mental health. I am the host, Dr. Tracey Guthrie, Psychiatry Residency Program Director and Co-Editor-in-Chief.
I'm the co-host, Dr. Camila Cosmo, Brown Assistant Professor and Co-Editor-in-Chief.
And I'm Dr. Elinore McCance-Katz, and I'm the guest for today's episode.
Welcome. We are happy to have you. So first, a content warning.
In this episode, we will talk about sensitive topics, some of which you may find triggering. Our only purpose is to provide education and information. Our content is not to be considered medical advice. So far in our podcast series, we've talked a lot about mental health conditions, diagnosis, and treatment options. But there is a big problem that we need to discuss. Lots of people with mental health disorders cannot get the help that they need, which has led to an ongoing crisis in mental health care and substance abuse treatment. These issues are even more pronounced for those dealing with housing instability and homelessness. One way to combat these issues is to work with our local and national governments, but that is not as straightforward as it sounds.
So in this episode, we will talk about how this problem started, what government help can look like, and what we can do next to make things better for people with mental health and substance use problems. To help us explore this topic, we are joined today by Dr. Elinore McCance-Katz, a clinical professor of psychiatry and human behavior at Brown and a specialist in addiction psychiatry, who has also served as Assistant Secretary for Mental Health and Substance Use in the U.S. Department of Health and Human Service. Dr. McCance-Katz's devotion to advocating and advancing mental health policies has left a lasting positive impact on mental health, and it is our pleasure to have her join us for this episode today. So welcome, Dr. McCance-Katz.
Thank you so much.
Welcome. So to better understand what is meant by public mental health crisis, how many people in the United States are struggling with mental health issues?
Large numbers. So every year, the government, through the Substance Abuse and Mental Health Services Administration, does a national survey. So every year, we get new numbers. And the most recent year for which we have the data is 2022. Mm-hmm. But what they tell us is that nearly 49 million Americans had substance use disorders and nearly 60 million had mental disorders. Now, that's from 2022. Mm-hmm. If you compare it to 2019, which was the year before the pandemic, those numbers were much smaller. So in 2019, we had less than 20 million people with substance use disorders and less with serious mental illness. Not that many less, but a couple million less. Mm-hmm. But the bottom line is that we've had a big increase in the number of people that have mental and substance use disorders and also co-occurring disorders. So people who have both a mental illness and a substance problem at the same time.
Mm-hmm. For people for those numbers, how many of those people, if we know, are having trouble finding help with mental health illness and substance use treatment? How many people are having trouble finding access to treatment?
Again, the numbers are very high, and our government is fully aware of this. Mm-hmm. So we know that if you have a mental health problem, a mental disorder, less than 50% will get treatment. If you have a substance problem, about 10% of Americans get treatment. Mm-hmm. Now, there's lots of reasons for that. Certainly access to care is one, but there are other issues as well that make it difficult for people to make that decision to get the help that they need. Mm-hmm. Mm-hmm.
And you mentioned this difference between pre and post-pandemic. What was the role of the pandemic on this increased number of people with substance use issues and also increased number of mental health issues overall?
Yeah. So during the pandemic, we had significant periods of time where people were really isolated from each other. Mm-hmm. To help to prevent the spread of the virus, we had to ask our people to stay at home. Mm-hmm. And for many people, that meant being alone. Mm-hmm. Even people in the same households were fearful and sometimes spent substantial amounts of time away from each other. And when that happens, people develop anxiety. They develop depression. They get kind of hopeless about the future. This went on for quite a long time in some states that had higher rates of viral infections than others. And the other thing that we saw was that people started to have lots more alcohol being delivered to their homes.
Right.
Very interesting statistic in 2020. We saw that there was higher alcohol sales during the time of the shutdowns than before, when all of the bars and restaurants were still ordering alcohol. So we had enormous amounts of alcohol going into homes. We had people that were bored, were feeling ill, were anxious. They started to use drugs.
Right.
We saw increases in the number of people that became addicted to fentanyl. We saw increases in deaths. We haven't recovered from that yet.
Right.
And the pandemic really is, I think, one of the keys. Now, one of the other things that happened that was, I would say, positive, if we could find a silver lining to anything, was the advent of telehealth.
Yeah.
We had telehealth prior to the pandemic, but mainly for medicine.
Right.
It wasn't being paid for people with mental health problems or substance problems. Now it is. It's a good thing.
Right. Right.
So, talking about access to care, what does this lack of access to care lead to? Are there any connections between mental health, poor access to care, and homelessness, incarceration?
Yes. So, and we can, I think maybe a good way to talk about this is just talking about how people become aware that they have a serious mental health problem. So we know that about half of people that are going to develop a serious mental illness have symptoms by the time they're 14 years old. By the time they're 24, 75% of people that are going to develop a serious mental illness become aware of those symptoms. Well, when you start thinking about it, people that are in their adolescence, those are some of the most important years of your life.
Right.
That's where you have to get your education. You pick a profession. You decide what you want to do, where you want to go in life, how you want to specialize, and you start to pursue those things. Well, if you develop a serious mental health problem, almost without exception, it affects your thinking. It affects your ability to plan and to organize. It's going to impact your ability to learn. It can be very difficult for your concentration. And then if you're going to develop a psychotic disorder where you have a mental illness of a severity that you can lose touch with reality, you may start to hear voices. Those voices may tell you to do things that you wouldn't otherwise do. They're frightening, and they can make the person believe that things are happening which really aren't. And that completely derails people. And so what happens within homes is that a lot of times these folks that are developing these serious mental illnesses will start to not relate to their family or to the folks they're living with in the way that they used to. Sometimes that means that they'll leave the home, or the family can even get to the point where they may ask them to leave the home. That leads to homelessness. And then when they get out on the street, what happens? Well, they don't have any more resources, but they have to eat. They have to try to find shelter. And so they may get involved in illegal activities. They may start to use drugs or alcohol to try to self-medicate some of these symptoms. And that brings them to the attention of law enforcement. And when it does, they often get incarcerated.
Right.
And this, in my experience, starts the revolving door of people that go from jail back out. They end up on the street again. They get arrested again. And
Endless.
it's just a revolving door.
So what factors do you think led to this position that we're in, that this is a national crisis? What can we point to start to have a discussion about this?
for many years, we have had a lot of very strong and different opinions about what is mental illness. What should we do about mental illness if somebody that we care about is affected? How can we help them? Should we help them? Or is this something that they simply choose to live with? A lot of conversations in those areas. Part of the history, back in the 1950s, we had over 500,000 people who had been placed in state mental hospital beds under terrible conditions. Terrible conditions.
Indeed.
There were stories written about this
Yes.
that led to the closure of most of the state hospital beds. We now have a fraction of that number of beds available in this country for people, and sometimes for people who really need those beds and cannot get them. Back in the 1960s, President Kennedy signed a law that created community mental health centers. So the idea was that we would close these state hospitals because people had a right to live in their communities. And we started to develop medications that could help them think more clearly so that they could live in the community. President Kennedy signed this law to create community mental health centers across the nation. The problem was that it was never fully funded.
Right.
And so that led to the start of the homelessness situation because there was nowhere for these folks to go. And we didn't have the mental health centers, but we did have jail cells. And so this really very unfortunate way of dealing with some of the most serious mental illness in this country evolved. And so the access issue becomes one of how have we done things historically. The other, I think, another impacting factor is that the way our country pays for healthcare is that we reimburse procedures at a high rate. So if you're a surgeon, if you're a radiologist, if you're anybody that does a procedure-based practice, you do very nicely in this country. What folks that have mental health and substance problems need is they need counseling.
Right.
They need therapy. They need medication. But they need all of those things, and those are not reimbursed at rates that, for many facilities, they can't even survive on the kinds of reimbursements that they get for providing these services. That decreases access. And then we also decrease access because our people that want to become healthcare providers, they take a look at the healthcare landscape. They also have to have careers. They have to survive. They go into areas where they're going to be able to make a good living. And the reality is that that's harder for people that go into the mental health and substance use disorder professions.
At the time that President Kennedy signed the Community Mental Health Act in 1963, it was like a reflex of what was going on in Europe. The experience of deinstitutionalization and the attempt of focusing community mental health centers was more successful there. Did you see any difference, looking historically to what happened in Europe and here in the U.S.? Did you see any major difference in why we are not able to get that funded and make the model work?
So I'm always reluctant to make comparisons to Europe because those are very different countries with very different cultures than what we have in the United States. People often like to look to some of these other countries in terms of their success in both mental health programs and substance use disorder programs. But the reality is that the populations are much smaller.
Right. Yeah, the numbers.
They're not
are a big issue.
nearly as diverse as the populations that we have. And in this country, it's really an obligation that we have to learn about the culture and the diversity of our own people. And we have to meet a lot of needs. That's not so easy to do compared to European nations where there may be communities of folks that really know, they know their folks very, very well. So
makes sense.
yeah. So that's the I think that's the difference.
But it's interesting to see that, like in those smaller communities, those models were successful, enable like to be efficient and like work well for the population that faced mental health conditions. But
yeah, so it's really an important point because communities are the key.
Mm-hmm.
Right.
Communities are the key, and communities within communities. So Providence is not a homogeneous community.
Mm-hmm.
And so it becomes really important that we learn about who the people are and meet their needs. Yes. That takes time, that takes a lot of effort. And when you have a situation where it's difficult to get folks to come into our behavioral health professions, it makes it a slower process. Right. But one that I think there's increasing awareness of and more ability to work with as we go forward.
Mm-hmm.
Are there examples of counties or states who are successfully working with local or federal government organizations to improve these issues that we're talking about?
Oh, there's lots and lots and lots. So from a federal government level, we have Medicare, we have Medicaid that takes care of a large number of our citizens.
Maybe we should define those two. Everybody gets them confused. So let's define Medicare and Medicaid, because we have a lot of folks, particularly when you're talking with patients or families, it's very difficult, it becomes very confusing. So could you define where those, where the funding for those programs come from?
As best I can.
Yes.
So the federal agency responsible for Medicare and Medicaid is called the Centers for Medicare and Medicaid Services.
Right.
Medicare we generally think of Medicare as the kind of health insurance from the federal government to the elderly.
Right. So once you hit age 65, you become eligible if you've worked and put in time and money into this. At 65, you get Medicare.
Medicare, exactly. Medicaid is a program for folks that are of limited means. Mm-hmm. One has to qualify financially for that program. It is actually a state program.
Right. That's a big difference for folks. One is state funded and one is federally funded.
Exactly. And so depending on the state,
right,
you can have a completely different set of services available.
Right.
That may not be available in another state.
Right.
The states will get federal reimbursement for whatever the cost of a service is. There is a federal contribution, and that is based on a formula for each state, mainly based on their population and the number of people that qualify to be beneficiaries. And the state pays the remaining. Mm-hmm. The remaining part.
Right.
And so the states have a lot to say about what kinds of services will or won't be covered and exactly what those services will look like. They also have a lot to say about auditing of these programs. Yep. They have a lot to say about how people that are licensed within their states can provide those services. So it's very different from Medicare, which is a national program. So there's one set of standards.
Correct. Right. Yeah, I think that's very helpful. Thank you for doing that.
So we have Medicare, Medicaid, and then we also have from the Substance Abuse and Mental Health Services Administration, we have what are called block grants. Mm-hmm. So the block grants started way back when, I believe with President Nixon, the block grants came into being. And what block grants were largish amounts of federal funding that was given directly to a state to meet the needs of their people. And so there are two major block grants. One is the mental health block grant. Mm-hmm. The second is the substance abuse prevention and treatment block grant.
Okay.
So the mental health block grant is used for mental health services. Substance abuse prevention and treatment, as the name implies, for substance abuse prevention and treatment services. For many states that have become Medicaid expansion states, a lot of those dollars go to prevention because Medicaid then becomes the primary payer. Mm-hmm. And so there are some states that have really innovative approaches to prevention. Other states that haven't expanded or have a more limited menu of services don't have the same kinds of prevention services, but I will say all states are aware of the importance of prevention for substance use disorders. Now, one of the important things about these block grants is that they help to supplement the services that are not provided by Medicaid.
Yeah.
So those funds can be used to enrich services, and that's really important because even with that, the reimbursements are they're limited. Mm-hmm. They're limited.
So let's sort of put this into a very concrete example, and correct me when I'm wrong. But let's say that you're a person seeking substance abuse treatment, and you have very intermittent housing as a result of your substance use. You're unable to keep a job. Mm-hmm. It's difficult. You lose your apartment. Mm-hmm. You've had maybe some legal issues, maybe some incarcerations. You're trying to get back on track. You seek help, and you go to your community mental health center. And at the community mental health center that has whatever their financial situation is, it impacts what they can offer. Mm-hmm. Right?
Yes.
So if you are attending a community mental health center that has a block grant, mm-hmm. for example, maybe they have some availability for short-term housing as a result of a prevention plan through their block grant to help you get stabilized in that sort of way, versus another state that doesn't have a block grant, that has put their this has to do with the financial issues that they have. They don't have these services to give you. Mm-hmm. And so I think it's important for people to understand that there's a big financial issue behind funding this care. It's not that the people you go in to see don't want to help you.
Absolutely.
They do want to help you, but what they can do, they maybe have a housing specialist with the block grant, and they can help you find, and they have contracts, or maybe even they own a building. Mm-hmm. They purchased a building to help give short-term housing for people. Mm-hmm. Maybe they have beds in a residential facility to get you on your way. Whereas another community mental health center, which is not as funded as well, may have a lot of difficulty giving you services. So they give you an outpatient appointment. They may be able to give you Suboxone, a medication to help you with opioid mm-hmm. addiction. They may be able to get you into group therapy, but the fundamental other issues of your life, they may not be able to help you with if the funding is not there.
There's another very important part of this that I think we just really should talk about, and that is that a lot of the most seriously mentally ill, a lot of the most severe substance use disorders are people who are incarcerated.
Yeah.
And those funds that we just talked about, Medicare, Medicaid, block grants, have not been used
Correct.
To help people who are incarcerated.
Right.
So often people who are incarcerated get little to no treatment.
Right.
And this, of course, disadvantages them greatly coming out when they still suffer the same symptoms.
Right.
One of the things that we were able to do back in 2020 was while I was working for Health and Human Services, I asked the question of government lawyers, why can't block grant dollars be used to pay for services, mm-hmm. mental health services within jails and prisons? After months, mm-hmm. I got an answer. And they said, we don't know. They said there's nothing in the law that restricts the ability to do this. Mm-hmm. And so I was able to send a letter to every state saying you can use block grant dollars to provide services as long as they are community providers. We won't pay for state personnel. Right. We won't pay for jail and prison staff to do this. We want community providers to go into these facilities and provide mental health care. And if they have a mental health and substance condition, they can get treatment for both, so that when they were to come out,
right,
they would be able to have a much better shot at success in the community.
Right.
That letter, I think, went out in February of 2020, and I think our shutdown started in March.
Yeah.
Oh, yeah.
Yeah.
So I know a few states have taken advantage of that, but I think most have not.
Yeah.
But I hope that over time they will, because it's a great example of how the federal government can come in and work with a state to get really very needed services to a very vulnerable population.
Yeah.
As a society, what else can we do to help to handle this crisis that we are going? So for example, as providers, sometimes we had the opportunity to treat some of those patients, especially with substance use disorders, in the inpatient level of care. And then for some communities that are well-resourced, we are able, for example, to transition them to a partial program. And then for some of them even get connected to residential program. So, but of course, this is not something that we have available as it should. What can we do as a society to change this picture? What are we missing?
So there are lots of ways to work in this area and help people with some of the greatest need. And I usually think about that as advocacy. And advocacy can be done by working in your community to identify needs and working towards getting those needs met. That includes talking to local and state and federal leaders about those issues and problems and looking to get resources to assist people. So that's one way. Sometimes one of the things I've learned in just the last couple of years is how strong an approach it is to bring a lawsuit against a county, in this case, that was not providing for people with serious mental illnesses and severe substance use disorders. We sued the County of Los Angeles for failing to provide mental health and substance abuse treatment services for unsheltered homeless people living on Skid Row. And I can tell you from visiting Skid Row and talking to people there myself, it was really a terrible situation, and it was a relatively large geographic area, but people were sort of encouraged to be in this area if they had these kinds of problems. The County of Los Angeles has an obligation, and so does the state of California, to serve this population. And they were not doing it. We brought a lawsuit to compel them to provide those services. And we were able to get a settlement where they are adding 3,000 new beds by 2027 to their county. Those beds will be everything from crisis intervention to child and adolescent, to adult beds, to residential programs, to board and care programs, recovery programs for substance use disorders. They are doubling the number of community outreach teams to try to reach people who are living on the streets and get them connected with services, and to try to provide housing to them. So there are ways to do it where people can just get together and say, the job of government is to provide for the health and safety of its people.
Right.
Indeed.
What I'm hoping people who are listening to the podcast are learning is that this problem, everyone really sees the tip of the iceberg, and everyone only focuses on the tip of the iceberg. And underneath, there's so many more layers. It's so complex. It's there are state pressures and issues. There are financial pressures. There are political pressures. There are biases that come into play, which I definitely do want to talk about. But if we take homelessness as the tip of the iceberg that communities are dealing with all across the nation, there's a lot underneath that. But the tip of the iceberg, the way to deal with that issue isn't just providing housing. It won't solve the problem because there are many other problems that led in many different ways to why that person has housing insecurity in the first place. So if we don't address those issues, they'll just continue. But we're a population that when things impact us, we take notice. And so that is now impacting a lot of people. People are seeing that. And I hope that people are hearing that there are many, many layers that we've got to be a little bit more nuanced about to think about how to address. And I don't mean just the lay public. I actually do mean physicians as well, because they're human beings as well, and they're also equally as at risk for biases and thinking through this. But it's a highly, highly nuanced way, because we didn't get here overnight, as you pointed out. This has been going on for many, 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 many years, and a lot of these consequences are from various decisions that were made along the way.
Yes.
So it's a very, very helpful conversation we're having today.
There's also, I would say that when you ask about partnerships, federal and state, there is a newer program that is being established in the states now. It's called the Certified Community Behavioral Health Clinic Program. And this is a program that is, in my view, this is the way of the future. This is how we will, I think, best serve people in need. And this program came out of observations by people that there's a program called Federally Qualified Health Centers. These provide mainly primary care to people, but they also provide mental health care, usually to people who have milder illnesses. And so in looking at the needs of people with serious mental illnesses, we thought we need the same thing. It's very difficult for somebody with a serious mental illness or a severe substance use disorder to get to all of the different kinds of care they're going to need. We know they have high rates of co-occurring conditions like other medical problems or other mental health problems or other substance problems. And so this idea of integrated care for serious mental health, people with serious mental health issues came into being. It is called the Certified Community Behavioral Health Clinic Model. And it brings physical health care, mental health care, and substance use disorder care into the same setting. It allows for case management so that people can have someone that helps them to coordinate all of the services that they need and helps to make sure they'll get those services. And it can help to do outreach to get housing for them, to help them get into educational programs if that's what they need. It takes a look at the whole person. This is a program that started back in 2014, and it has continued to the present. And every administration has been dedicated to increasing this program. At SAMHSA, at the Substance Abuse and Mental Health Services Administration, that program in 2017 was about $100 million, and by the time I left in 2021, it was $450 million, just as an example. And that's because there was understanding, and there's been understanding by our leaders in general, and I'm happy to say that this is an important problem that needs to be addressed. And a couple of years ago, a law was passed and signed into law that made this permanent and provides funding to the states so that they can establish these programs. I think it's a wonderful example of how the states can work with the federal government to the benefit of some of our most vulnerable.
Indeed. And it's interesting that aligns with what you were mentioning at the beginning about like understanding the community, understanding their needs, and meeting where they are. Instead of expecting like people struggling with mental health issues or substance use to like navigate the system.
So I can imagine someone listening to this episode is hearing us talk about large sums of money that is available to the states. Well, where is this for me? And it also leads me to think about the episode that we're doing right now. It's a very different type of episode. Up until this point, we've talked about diagnoses and trying to clarify what the diagnosis is and what it means, and educating people about that, and access to treatment and educating them about treatment. But we really did think that this episode was really important for people to understand a little bit of the background about why we're in the situation that we're in with a mental health crisis. So this episode is really not only about how we got here and why we're in this situation, but trying to give people an understanding of the complexity of the entire situation. And we're so fortunate to have you here, someone who's worked in all of that, within every aspect of that, federally, in the state and the communities. That's an unbelievable treasure. And I hope that people are able to maybe re-listen to this podcast. Maybe it's not as direct and linear as our other podcasts, but to understand and ask questions about. Are there any programs that are available to me? Advocate for yourself as a patient, which leads us to what I want to sort of talk about as our last two questions. One is about how whether you are a person who is accessing care, someone who is a family member, someone who's a community member who sees this as their responsibility, as we all should. Let's talk a little bit about advocacy, and then we'll talk a little bit about access, because I know people often tune in to hear about what can I do? How can I get care?
So you were mentioning about like the importance of people understand their communities and understand their needs. So we are wondering, how can people help advocate for change in their hometowns?
I think we really have to get much more granular and encourage people who live in communities who struggle with issues to come forward and talk to their elected leaders, because elected leaders have accountability. They have accountability by the fact that we vote for them. And so that's an important resource, and one that I think needs to be used more. I've never found any elected leader that wasn't interested in hearing about what the issues are for their constituents. That's what they do. That's why they chose to be in these positions. So that's important. At the same time, there are also state advocates. There's a state advocate for people that need elder care. There's a state advocate for people that need mental health and substance problem help. Those are resources that can be tapped. And there are, of course, providers. And providers also choose what they do because they care about the people that they're working with, and they also can advocate, and they can be very effective advocates. So all of those things are important in getting assistance. For example, one of the things we know in Rhode Island is that we have a huge issue with a lack of access to care for children and adolescents, for our youth. And so one of the things I can tell you is that in Rhode Island, for their CCBHC program, they're going to have a special emphasis on children and adolescents and trying to get more services to them. How do they know to do that? Because they hear from the public. They hear from parents who are struggling with children in need. They hear from practitioners who are trying to work with these children. They hear from people at hospitals, in EDs, that are seeing the difficulties that these young people are experiencing. And so that will be a focus. And I think that's a nice example of what advocacy can do.
Yeah, I think it's very important to realize that you don't need a special invitation or to know someone or a red carpet to speak to your elected official.
Right.
Their numbers are available online. You can call them, you can email them, you can contact them in any sort of way to discuss an issue. And I, too, have never had someone not get back to me or, not be interested in a concern that I raise. So I really want to encourage people to use that process because it does work. It just needs to be utilized.
Yes.
So let's sort of wrap up and end with access? Because again, we've talked about a lot of different things, and as we always do on their podcast, we talk about stigma and how this affects access to care. And we've discussed lots of different things, but I want to try to focus a little bit about what can we say to someone listening to this, and maybe tuning in thinking, I can not only learn something about this, but now I do want to seek help. I do want to go, and I want to make sure I'm advocating for myself in the best way to access care, whether my problem is a substance abuse problem, a mental health problem, or as often go together. They're together. You have both issues. What advice can we give people who are seeking to access care right now?
Sure. I think that there are two ways that I would recommend people use. You can call the 988 number, which some people think of it as just a crisis intervention number, but they also can link people to behavioral health services. So there is a crisis service in Rhode Island called BH Link. So if someone's in crisis, they can help you get to those crisis services, but they can also help you to think about what might be the best care that you can get in your area, based on what your needs are. So I would encourage people to use 988. But there is also, if you have access to online internet services, and you can do this in your library if you don't have that access, is a website called findtreatment.gov. If you go to that website, you will find, you just need to put in your zip code, and you will get information about mental health services, substance abuse treatment services, and primary care services. And you can pick what you're looking for. You can have it give you facilities if you have a particular type of need. Let's say you're a woman that wants to get special services for women. You can put that in. Let's say you're a veteran and you want services, particularly that help veterans. You can do that. Let's say LGBTQ plus. You can also do that. So this is actually a very good website. I don't know that everybody knows about it. But it was started a number of years ago. I think it was put in place maybe 2019. And it has continued to the present, and it's been improved each year. The service itself has the facilities listed. It will tell you what services are offered, what forms of payment, insurance that's taken. It makes it easier for you, and it'll give you contact information. So findtreatment.gov.
Very helpful.
Excellent.
So findtreatment.gov and 988 are national.
Yes.
Points of access to care. BH Link is local to
Rhode Island.
Just to be
Absolutely, that's
clear
right.
for our listeners. Okay, fantastic.
That was very helpful. Thank
Yes.
you so much, Dr. McKenz-Katz. We are really glad to have you here.
Thank you.
Thank you.
Now a take-home message to bear in mind.
The current crisis in mental health care is rooted in several problems within our healthcare system. To address it, we need a multifaceted approach that tackles several key areas, including increasing access to care, expanding and strengthening our mental health workforce, reducing stigma, and advocating for increased funding and resources.
We hope our episode has helped you to learn more about what has caused this crisis, the main issues related to it, and the implications for our community members and ways to improve the current situation, including through mental health advocacy.
As always, if you or someone you know is having suicidal thoughts, please contact the Suicide and Crisis Lifeline or call or text 988 or access 988lifeline.org.
Thank you for listening to our podcast. For more information related content, please check out our Instagram, X, Facebook, and YouTube channels. Bear in mind the Brown Psychiatry podcast.
Thank you, Dr. McCance-Katz.
Thank you all.